I'm not used to the hairy chest. My husband
Particular,
has two
right?
hairs. Can I get you more comfortable? I'm not used to hairy.
Alrighty, class. Welcome back. Thanks
I
for
want a
the...
hairy back competition.
Really? Hair back to it?
Hey.
Alright, we're gonna bring it back in. I'm passing out some post-it notes. So we've already done an introduction from the last session. We still have the same 8 students here. And we are going to start, instead of doing introductions again, because I'd like to think we'll remember each other's names, we're going to start with a little game where I've handed you all out some post-it notes. And the post-it notes have different bodily functions. So some of you have 2, some of you have 1 just because there was an uneven number. But I want you as a group to work out, maybe we can stick them here on the ground in a nice line. I want you to work out what's the most important bodily function for our bodies to do to the least important out of what I've given you. Okay, so we're talking about staying alive and everything. So you guys can work this out. Maybe we'll do most important here, ranging to least important here. I'll give you a couple minutes to do that.
So,
Okay.
Can we all
So
come
we just
over
one
and
of them.
can everyone read those out?
I don't know what everybody has, so
Read them out.
Breathe in oxygen.
That's pretty
That's number
important.
1.
That's
Yeah.
And how about you? Deliver oxygen.
Why don't we put them right here?
Okay.
Put them here. They're supposed
Sure, you can put them up there. I like that. Great.
And we can post
Great
them as we
suggestion,
go.
Sue.
Well, what are the other options?
So well, you need to read them all out so we can.
Chewing food is probably down here.
Yeah.
Yeah. I
I'm
got
not gonna digest
reproduction.
food. I'll pop that there for the moment.
Depends on how what you think reproduction is.
What's your other one? You've got 2.
I've got uses senses to collect information for the brain.
What have you got, Jeff?
I got,
Reproduction.
I got
I
make
would
the
say this is
decision.
gonna be right up there.
Hey, do as you're all told.
Okay.
I got make decision.
Ooh.
So that's the first one.
No, that's
Make
not the first
decision.
one.
No, Timmy for census.
Got to make decision.
You can't make decisions if you can't breathe in oxygen.
What?
Or you can't
Yeah.
deliver oxygen to yourselves. Or if you maintain your
I
blood
thought I'm the
pressure.
doctor or the nurse,
No, you're
not the patient.
That one's
If I'm the
interesting.
doctor or the
Yeah.
nurse, I'm the one who makes
But
the
you
decision.
still, if you're a doctor or nurse, you can't still
So what
make
if you're
decisions if you can't do
So
that.
what if you're unconscious? You can't make a decision.
But that's the problem.
For life.
No,
Yeah,
I'm
life.
looking at
We're
that.
humans,
I'm
we're
looking
wrong.
at you.
Yeah.
The
You're
only
looking at
reason why you're unconscious is because you're not doing
Oh,
that.
so this is all the patients.
This is
This
for
is
employees
anyone
to
who-
survive.
This is any
This is all the
person.
patients.
So
not the-
I'll just clarify,
not the people
Jeff.
helping.
Patient,
No,
don't
correct.
think patient nurse,
Huh?
think
Patient,
person.
correct.
I'll just
Okay.
clarify, it's for
I looked at
any
it as a
human.
It's for
as a
any, stop
people
thinking
turn up.
patient.
It's for any human. So it doesn't matter if they're a patient, if they're a truck driver, if they're a nurse, if
He
they're a
No,
advises
child.
the nurse to make decision was number 1.
No,
That's
so-
why the nurse needs to make decisions correctly.
No, it's just for any
Senses
human.
would
Yeah.
If you
Takes
got
over.
wood
No,
on
no,
it,
no, no,
breathe in.
Yeah, you're right.
Back right on
So
that.
that's the-
And you're like, I'm making a decision, this is number
This is what
1.
you're doing. That's
Yeah,
what you're
what
doing.
So because you think about it, you can't use your senses.
Yeah, well, I said, yeah.
If you can't get
And I
oxygen
don't
to
know
yourself,
what
you
the
can't
others are,
do it.
but
You can't
those,
maintain
I
your
mean,
blood
yeah,
pressure.
obviously.
So I
Well,
would
they
say
are, but I
it's
don't know
like
what the
here.
others are, so I think we have to see them all first.
So where?
We need
what
to
are
see
yours?
them first to make a decision.
Yeah, everyone needs to read them. Can you just set yours anywhere and then I'll just read them in the order?
Alyssa's like, I'll just make the
Jeff's
decision.
just not a team player.
She's doing
No,
it.
I'm not.
No, Jeff, I said.
No. I think
Alyssa's a good team player. She just likes to be in charge of the team.
Yes, I do.
absolutely.
No.
I think that was
So-
making decisions, wasn't it?
Okay, this is the order from left is the most important. We have breathe in oxygen. Then the next is deliver oxygen to the cells. Then next is maintain blood pressure. Then next is we have, I'm thinking maybe after that should be filter
I agree.
blood to
Yeah.
excrete waste.
Yeah.
And then after that, defend against pathogens, and then movement using muscles, and then using senses to collect information for the brain, and then produce sweat to cool down the body, then make decisions, then chew food, then digest food, then reproduction.
Alright.
Any objections?
Oh, I don't know about make decisions.
Yeah, but
Well
it's,
done,
it's the
Teresa.
patient who has to make
Well
decisions.
done.
Oh,
It's the
okay.
patient.
It's anyone. It's any human.
It's any, we're not thinking about patients and
It's
doctors
any
and
human.
nurses.
It's just
We're
your
thinking
body in
humanity.
general.
Right.
If you,
Oh, yeah, don't put yourself in danger and stuff. I don't know.
If you're done, you can come sit back down in the classroom.
Are we? Alright.
Yeah, did you forget to get a refreshment? Do you need...
No, no.
Okay,
no.
yeah, I'll get you to sit back down.
No, we're just talking.
Okay, well,
Well,
your
no.
seat's up here, so you can sit down.
Is there any
Well, that's
objections?
fine.
No, no, we'll sit down, we'll discuss it as a group. So it looks like you've got a pretty good list.
You're right.
Consensus.
We'll get everyone to sit down
Yeah, anyway.
and
Doesn't
we'll
matter.
check it out. So it was very tricky, there's no correct answer. Just more correct. answers.
Interesting.
So,
Oh.
if we look at what we've done, we've got our first as breathe in oxygen. That seems pretty correct. Yep, you did that. That was yours. Well done,
Well
Sam.
done. Well done, Sam.
So yeah, we need to breathe to be able to actually get oxygen to deliver to the cells. So yeah, those two kind of go hand in hand. So that's great. Then we've got maintain blood pressure. Definitely need to do that. That's something that our body does naturally. We love that. Filter blood to excrete waste. That's where like you might hear people that go on dialysis because their kidneys can't filter the waste. And so they just have all this waste built up in their body and can make them really sick. So it's definitely important. You can't live super long if you can't get rid of the waste. Defend against pathogens. That's our immune system. We definitely need that to work. If we're just sick all the time and our immune system doesn't work, then that's not great. Moving, pretty optional, right? There's people that are paraplegics, quadriplegics, their muscles don't work in the same way that yours and mine do right now. They can still live. That's a good placement for it. Use sensors to collect information from the brain. Alyssa and I were talking about people that we know, they got COVID and they have lost the ability to taste and smell and they're still living, you know? So that's a good one. We don't need that, you know, it's great. It would be good if we can use it, but it's not the biggest thing. Produce sweat to cool down the body. Also good. You can cool down your body with external things if you need to, like paraplegics sometimes don't have the ability to cool down their body. So that's good where you've placed it. Digest food, love that. I saw Teresa moved it because we had chew food above digest food and that was my only criticism that was going to be because some people like have a feeding tube that goes through their nose and they don't need to chew it, they just need to be able to digest it. So digesting is more important than chewing, so good job. I tried to trick you with that.
Thanks.
One. Making decisions, that one got us all a bit stuck because Jeff had a good point. He was like, you told me that making decisions in an emergency is important. That's number one. And I was like, yes, but we're just talking in general. So some people.
And I told you you can't make decisions if you can't breathe.
Yeah, true. That's true.
Well, it depends if I'm running the show or not.
And then we have chewing food and reproduction. If we can't or don't reproduce, we'll still live. The human race might not live, but we personally will. So that's okay. Good work. I just wanted us to get thinking about all the different things and how they all go in with each other and how they're all important in different ways because we are going to get moving on to other parts of emergency situations and first aid. Okay, so the first thing that we're going to look at is the recovery position. It is the position that someone will go in when they are unconscious but breathing. So in your doctor's ABCD, if you came to someone and they were laying there and they weren't responding but they did have normal breathing, you put them in a recovery position. Can I please have a volunteer?
Jeff. No.
Come on in. Okay, so I'm going to get you, if you don't mind. Oh.
Take off my skirt.
Lay down on the ground for me. Thank you. So Imogen is unconscious. Oh, he comes Jody. Oh God.
Jody's like, oh no!
Rescue hearing the face.
So we're saying, can you hear me? Can you hear me? Is she responding? She's not responding. She didn't pee on you. It's okay. But she is breathing. We've done our look, listen, feel. Sorry. Our look, listen, feel. And
Breathe.
She breathes. Okay, we are in a pandemic. Okay. So she is breathing, we need to put her in a recovery position. So to do that, you will kneel on one side of them, just like this. And the arm that is furthest from you, you're gonna put out at a 90-degree angle like this, okay? The arm that is closest to you, you cross over, and you bring the leg closest to you up to, come keep you decent.
That's a good
up
friend.
to there, so like their foot is in line with their knee, all right? Then from there, because you've got to think as well, a lot of it could be someone who's much heavier than you. You know, it could be a little petite thing and you're trying to roll this big old guy. You should be able to do this with them. Part of it is being able to get momentum and gravity on your side. So we're going to be very careful and we're going to roll her arm and her knee. We're going to roll towards her arm there. This knee acts as a brake. We can put that there. And then her face is supported. Kind of. It's okay. You know? So she's like that. If she vomits, it's going to come out this way. That's also why you don't want to roll them towards you. Because if she vomits, I don't want her vomiting on me. I want her vomiting away from me. Okay? And that is a recovery position. So, like we said before in our example, someone who's disgustingly drunk and has passed out, if they're still breathing, but you think they might vomit, you can put them in this position. It's great. This is something that I have used a lot. Not on myself, but on other people. You know, it's a very good thing. Thank you, Imogen. You can wake up now. Yeah, that's the recovery position. Yay, well done.
Jody's come to see you.
She's so excited.
Worried about you.
Yeah. Are you okay?
We had a student who would have epileptic
Yeah.
seizures, and after the general seizure,
Yeah.
we put them in the
Yeah.
Yeah.
recovery
It's very,
position.
very good.
It's a very good position
Yeah.
to know in so many situations. One thing to be aware of is, and we won't cover this in this class, but if you have any reason to think that they could have had like a spinal injury, so in some sporting situations and stuff, you won't see them do that because they're like, oh, if they hurt their neck or their back, you know. But if Imogen just passed out or is drunk, then you can put her in that position
Sorry,
and
guys.
safe. So
Try to keep it to a minimum.
okay. All right. So we're gonna go on to choking. Who here has choked on something before?
Oh, sorry.
Are you guys kidding me?
Like water?
You've never choked on anything? You've never like had a drink of something or
Goes a long way.
Swallowed a blowfly.
Yeah,
Oh,
there
did
you
it
go.
make you cough?
Yeah.
Did you choke? Did you go, oh, that stuff? Oh, did you breathe water?
It
in
depends
your way?
on their.
My husband makes this balsamic vinaigrette, and every time I have it, I choke.
Yeah.
There you go.
You've
Yeah.
got to stop it.
You need to stop
I've
having
actually
it.
had that balsamic vinaigrette and I think it's delicious. So I'm okay if he keeps doing it. Just send it to me. So it is really common. I would have thought that almost all of you would have raised your hands. That surprised me.
Well,
I
I
think
was
people
thinking
have
of it
different
as well.
ideas
Yeah.
of what you mean by choking, maybe.
It's true.
They might mean that they needed someone to come to their aid.
Yeah.
Yeah.
Do you know what I mean? I wonder if that's why they didn't
Yeah.
listen.
Swallow water the wrong way.
Yeah, that's choking. Yeah.
Completely choke.
And the good thing is that our bodies have defense mechanisms to prevent it from being anything bigger, you know? That's why we cough. During the break, Alyssa, Imogen and I were talking about doing CPR on babies and how in a hospital you would use like a little suction thing to get all their snot out because babies are very snotty. But in CPR, we're not going to do that. We don't have suction. So when you blow, that snot is probably going to go into their lungs, and that's okay. They're going to cough. That's part of our defense mechanisms of our bodies trying to get us to be okay. You're going to cough. So a lot of the time, I'd say almost everyone should have choked at some point in their life and been okay from it. It's great. We haven't died. I love it. Okay, so food is a super common cause of choking. That's what the only thing that I really choked on, or water, like you said. And if they are still coughing, or if they could say to you, I'm choking, it's good because it means that it's only a partial block. It means that air's still coming through. Coughing, air's coming out. Talking, air's coming out. They're still able to breathe, limited, but still able to breathe a bit, which is great. We love that. So if they are choking, these are the symptoms that you'll see. So they'll clutch at their throat. They might not be able to speak, or they'll be limited speak, like my little mimic before, like I'm choking. It's like a different voice that they use. And there can be some wheezing, gagging, red face, and they can start to have like blue lips and things like that if it is a major block. So when they're coughing, when they're choking, you want to encourage coughing as much as you can, especially if they are coughing, that's great. And then you want to do 5 back blows. So to do a back blow, what you're going to do, thank you, Alyssa. Thank you so much.
She's always wanted to hit you.
Alright.
Waiting for this moment.
So what you're gonna do is we're gonna face back to back like this. That's perfect. She's choking.
Back to front.
Yeah, back to front. Well done. Because back to back would have been like this. Good job. Okay, and I want to support Alyssa. Okay, so I'm gonna put my arm across here like this. Okay, and I'm gonna get her to bend forward. So bending forward. Okay, this will help so that if she's gonna try and cough something out, she doesn't have to cough it up. You know, it's gonna help with gravity. It has to go further. It's gonna do the right thing. Okay, then we're going to use the heel of our hand like we did in CPR, and you're going to do it like in between her shoulder blades. And you want to push up. You want to help try and dislodge it. I'm not going to do it because it'll hurt. But you want to go hard. You want to push really hard. And you want to see every time if it's dislodged. The good thing is if she's choking, she should be conscious. Like if we're doing back blows, she's conscious. Otherwise we would have been doing CPR. So because she's conscious, she'll kind of let, she'll be like, yeah, or she'll just keep choking. So do 5 back blows, right? And if that doesn't work, we stand up and we check. Hasn't worked? No. Okay, so then we're going to do chest thrusts. So we have our hand, we'll have one hand on the front and one hand on the back like we do for CPR. And we're going to thrust upwards, okay? Again, pushing up. We don't do the Heimlich maneuver. That's not something that's taught. That's not something that's in the movies. They're like, Heimlich maneuver in the same way that they're like, shock at someone who doesn't have a heart rate. Okay, it's not right. So never go up to someone and be like, I'm gonna do the Heimlich maneuver. No, we do the back blows and then we do the 5 chest thrusts. So in the CPR position, and we're gonna push upwards. Okay, we're gonna try to do that. Thank you.
You're welcome.
It's like by a bra strap for women to remember.
Well
Just-
done. I like that.
Just a little
Yeah.
memory trick for us ladies.
I like that. That is a good one. Yeah. So yeah, if you wear a bra as well, wherever your bra strap sits, yeah, in between your shoulder blades or where your bra strap is, love that. And you want to be pushing up. Same way with chest thrust, you want to push up. We want to be checking in between.
Sternum at the front.
Yeah, yeah. The sternum at the front and at the back, and you're going to push up.
Narelle just had very good technique. I could see, yeah.
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 Very
It
graceful.
looks, it looks
Yeah.
like Swan Lake or
It
something.
does.
Yeah, so we want to be strong. We want to be pushing up, okay,
It's
and
often-
checking.
It's often children that have trouble.
Yes, yeah.
So you've got to be kids.
I'm not teaching you how to do children in this, just so you know. It just takes too long. There's so many differences. But yes, but you can do this on children as well. With babies, you can lay them on your arm, and you can do it
With their head down.
with their head down, not up, because otherwise it has to go up, which is silly. Gravity is our friend. So that's how we do choking. If after 5 back blows and 5 chest thrusts, it hasn't resolved, you definitely want to call 000, and you keep doing the back blows and the chest thrusts until they get rid of it or an ambulance comes. What happens if they become unconscious? Yeah. So they're unconscious, they're not responding. We've already called an ambulance. That's great. Their airway is blocked, which means they are not breathing. Which means we need to do CPR. Perfect. Great. So it all folds back into each other. Love that. Cool. Okay. Asthma. 11.2% of Australians have asthma. Who in this room has asthma? 1, 2, 3. Yeah, that's even more than 11.2% of us, but it is quite common.
Melbourne's the worst city for it.
Yeah, what?
I only get it after a chest infection.
Yeah,
So that I don't know whether it's called asthma because I get given a puffer, but it only comes on after a really bad chest infection.
interesting.
That's what I
Well,
found.
there's an exacerbation of
Yeah.
it.
I-
Something causes it.
Yeah.
There are different forms of it though.
Yes.
Like, I had
Yeah.
childhood asthma, so I've kind of grown out of it.
Matthew is the same.
Yeah.
So, what does it feel like when you have an asthma attack? I've never had one.
I cough a lot.
Cough a lot.
Yeah.
Can't breathe.
Yeah.
Does it feel like breathing through a straw? That's what someone explained to me.
No, I don't. I haven't had that impression, but sometimes I can't take my inhaler because I'm just coughing it out, but I can breathe in.
Wow.
Yeah.
I have heard that it feels like breathing through a straw, so I'm intrigued that you don't think it does. I have no
I suppose
idea.
everyone's different.
probably is different
And
for
are
everyone.
triggered by different things.
Yeah.
So you have the people that have the thunderstorm asthma
Yeah.
from pollen, so it
Yeah.
didn't affect me at all.
Yeah.
I'm
Good.
triggered by dust and mold,
Yeah.
and like Susie, having had any chest infection or cold.
I get quite lightheaded because the air's not going.
Yes.
Yeah.
Or change of temperature too.
Lightheadedness and
Yeah.
I like I'm feeling today actually.
Yeah.
I feel
Shortness of breath.
what's wrong with me? I'm not feeling right.
Yeah. And then
Yeah.
like, wait, I'm not breathing properly.
Yeah.
Soz.
Yeah. So that all makes sense. So with asthma, you can see here. This is a normal airway. It's nice and open. You get all that air through. With asthma, the airway is narrowed. The muscles constrict, and the airway wall gets inflamed, which just continues to restrict it. And there's a build-up of mucus. So you've got to look at how little the air is that can get through there. I don't know if you guys can see, but down here it's actually mucus. So it's not even just that small bit, it's this teeny bit, you know, whereas there it can fly through. So I thought we'd do a little activity to try.
Johnny's really
If you have asthma or you don't want to do this, that's okay, you know, but we're just going to try this. We're not going to do it for long because I tried it and you do get quite dizzy. Pro tip, you can breathe through your nose if you want, but when I was doing it, I was like, this is really easy, and it's because I was accidentally breathing through my nose as well. So I found it easier to pinch my nose to really get the full effect of it, you know? Alright, so if you want to grab a straw,
Yeah, good idea.
I won't do it because
Yeah.
would you like to? No.
Yeah.
Alright.
Well, I'll
Jeff's
do it.
brave.
I'll do it.
Hey,
Good on
Jeff,
you, Teresa.
this new share coming out, well, it's out,
The blue one.
RSH.
Oh, you've just touched it. We're in a pandemic. I'm going to get you to just touch that one.
So you can actually, it's like having a stethoscope at a doctor. You can work out what you want.
Susie, would you like one? Okay, so you guys can just try and breathe through that. Let's just give you a bit of an idea. You're usually able to breathe through your entire airway, but with this, you're just breathing through that tiny little straw. It's difficult, and you might start to get lightheaded and all of that. Some of those, we don't need to pass out. Please don't.
No,
Right.
but the first few breaths I thought, well, that's not that hard. But
Yeah.
after a while, I had to do really long breaths to get enough.
It
and
builds
it does it does build up. It does.
And
make you
I
cough.
felt when I did
I've
it,
never done
I
that.
have a really good lung capacity, and I felt, even though I was like doing it to myself, I felt like rising anxiety. I was like, oh, I'm not getting better. I'm trying really hard. I'm just breathing. Why isn't it working? You know,
That's why that becomes like I call an asthma attack when you do start panicking.
Oh yeah.
Because I don't get to that stage. I
That was-
just
But
You
then
know.
you hyperventilate.
feel
But
it.
that's
Yes,
the thunderstorm asthma. So they said when they came out with the statistics of the people involved, like who got it, a lot of people weren't asthmatic because you as an asthmatic would know what to do in that situation. You would try and calm yourself down, whereas these people are all of a sudden were like, what's going
They've
on?
never had asthma
And it
before.
makes it so much worse because that is the panic that sets in where you're like, I'm not breathing, I'm not, you know? Yeah.
Yeah, absolutely. Cool. So that's our straw activity. So we've already talked about the symptoms, but a lot of asthma is diagnosed with multiple things, but wheezing is a big one. And you can hear wheezing with the stethoscope. A doctor will listen and you'll hear it. Shortness of breath, chest tightness, and coughing. So you were saying before as well what triggers your asthma. What triggers other people's asthma? Anyone? Chest infections, dust and mold,
Pollen.
Working out sometimes.
working out. Yeah. And you said changes in weather.
Yeah, it
Animals.
turns cold.
Yeah,
the
seasons.
winter for you.
Yeah.
Yeah.
Yeah, I found when I was living in Canada, it was so cold and dry, the air outside, and then I'd go into my house and the heater was pumping, it was so hot, I would cough for 25 minutes. I'd be talking on the phone to Mum, and I'd be walking home from work and I'd be fine. I'd go in the door, and the change in humidity and temperature, I would just cough and cough and cough and cough
Yeah.
and cough.
And that would be the same if you like travel, like it would be different pollen in different parts of the country or the world
Yeah.
and humidity levels.
I
So
get it
that's-
with, hot and cold drinks as well, you're fine.
Mm.
So like the so mango sorbet, like not sorbet, mango smoothies. Don't know what's mango. It's always mango.
Yeah.
But yeah, I won't have like boost smoothies for that reason. It'll make me cough.
Mm.
Like,
What?
Different foods do it.
I can't live like that.
Sorry, I'll leave like that for you.
Alrighty, so to manage asthma, asthmatics will have a reliever puffer, and it will be usually blue or grey, and that'll help to
And
reduce.
it's preventative.
Yes, but for us, we're not worrying about the preventative. We're worrying about the asthma attack and the management of that in an emergency situation. So they'll have this blue or grey puffer. They should have it on them, and it'll just help reduce the mucus and the inflammation, so that they can breathe a bit better. If there's a space, you should use it. So you'll see a lot of people just put it straight in their mouth. That works, that's okay, but it does coat their mouth, and it means that they aren't able to breathe in as much of the medication. If you use a spacer, each breath takes in more of the medication rather than it like soaking into your mouth, which doesn't help your lungs. You want it to soak into your lung tissue. So if there's a spacer available, use that. If not, you can still do it. So what we'll do is, it's called 4x4x4. So you can do 4 puffs, but in between each puff, you can do 4 breaths. You do a puff, you do 4 deep breaths. You can talk them through it. They'll know how to do it as well. But 4 deep breaths. You do another one. So you do 4 breaths, 4 puffs with 4 breaths each, and you wait 4 minutes to see if it gets any better. If it doesn't, you repeat that again. And if it doesn't get better after that second one, you call 000, and you keep going until an ambulance arrives. What happens if they stop breathing? Doctors A, B, C, D. Yep. They're not responding. The airway's clear. They're not breathing. Yeah. CPR. Yes.
Does everyone know what a spacer looks like? Because not everyone may know what it looks like if they're
You
looking
can
to
bring
find
mine.
it.
I've got
I
mine.
don't have.
Good. I was wondering if they both use them. So you do. Good.
No, not in my bag. I've got a spacer at home, and it's like a
Just a plastic
cylinder,
bubble.
plastic clear thing, and you
bring it
put
out with
your
Yeah.
Puffer.
It's
puffer
not like a
in
little,
one end,
Yeah.
and mouth the
And
other.
the mouth the
Yeah.
other, and
Right.
then
Yeah,
The
good.
good news is with asthmatics is that they will know how to do it. So they will be pretty independent. They might not be able to go and get their bags on the other side of the field or something, and that's where you come in. But they generally will need your help a bit, but they can put the puffer in.
Yeah, and they should have their
They
equipment.
should know how to
Yeah,
do
they
it.
just
you
need to
know?
be calmed down.
They just
and-
need, your job is to help, calm them down, help them if they need it,
Yeah.
and to think clearly, you know? They're having that anxiety of like, oh my gosh, I can't breathe, I'm dizzy, you know? So you want to help them through it, but they do know. So even if you don't know how to use a spacer, they know how to use their spacer. If they're unconscious and can't tell you, then you go through doctor's ABCD.
They don't need their spacer.
I guess COVID pending, because that wasn't a thing beforehand. But having, like, normally I will carry it always with me. And so then I also have had people ask, has anyone got a puffer? Like, if this person's asthmatic, they don't have it. Does anyone have one, or this person's suffering?
I've never liked.
See, and that's the thing. Pre-COVID, I didn't have any issue with it.
Yeah.
But then I know that some people are like, you shouldn't, like, it's technically a form of medication, shouldn't just go give it out
So,
willy-nilly.
yeah, we'll talk about that with multiple things in this
Because
one.
this is the problem you have in schools. is that
Yeah.
We've had every kind of emergency, and with the asthma one, you have to decide, okay, this kid's going to die if I don't give it the one that's in the first aid kit.
So with that, the technical answer is no, you don't share medication. But there also is the judgment of risk versus benefit, and if we don't give it to them, then they will be very sick or die. And with the puffer, at least you have multiple puffs.
Yeah,
It's not
I
like
just
a
thought about that when I
one-time
asked
use.
you the question.
You know?
Yeah.
And the good thing as well with a puffer is that, especially in Australia, they're subsidised. They're not the most expensive thing. It's like a $1,000 thing. So if you gave it to someone and you were worried about COVID, you can still go and get another one from the pharmacy if you needed to, and not have to use your COVID one. You know? So there is that question, and that is something that you can make the decision at the time. The general medical recommendation is you do not share medicine. But if someone needs a puffer and you have one, that's up to your discretion.
And Ventolin's an over-the-counter
That's right.
medication.
It's not in Canada, but it is over the
I was
counter.
gonna say, I don't think it is in the US either.
Yeah, I don't think so. I think it depends where you're at.
Yeah, but here it is, which is really great.
So
So
anyone can use them.
yeah, so it's okay.
Capital.
But yeah, that is something you can decide. COVID or no COVID. The general thing is do not share. But if
I would
they
also
need
be
it,
worried if someone giving you one, what if theirs is really old and expired and it won't work? That would be my concern, receiving one.
But if you need it, like I'd rather have an expired one than not one at all.
Yeah.
You know?
Yeah.
And you can wash out the dispenser.
Yeah.
Oh, the amount of
It
things
might
that
have
I've
a
lost
bit
or
of a,
chucked out or whatever.
what's that,
I just chucked it
Like
away.
a bathroom.
Someone's using it anymore.
Yeah, well, that's the thing. I don't carry mine on me
not
because I
your
got
medicine.
cleared. Like I have it just in case I go out.
All right, we're going to bring it back in just because our last one went over time, so we can discuss this later. So we're going to move on to allergic reactions and anaphylaxis. What allergies do you guys know of?
Peanuts.
Peanuts.
Medication.
Medication.
Trees.
Grass.
Imogen, what are you allergic to?
Animals.
Animals,
Some
my cat.
Yeah.
Yeah.
Cats.
Animals, cats,
Yeah.
certain trees,
Pollen.
pollen,
Yeah.
Did we say food?
Honey.
food,
Yeah.
Bees.
bees.
I just said peanuts.
Lots of things.
Everything.
So many
Shellfish.
things. People are allergic to
Soap.
everything.
Soap.
Yeah, materials.
So
People.
cereal.
People.
Yeah, metal.
Yes, people.
Yes, Imogen and I donate plasma, and we get itchy if they
Yes.
use their
Wow.
crate bandage. We need the cotton bandage because we get itchy.
Mm.
Mild, but it's still an allergic reaction.
Mm.
Anaphylaxis is the most serious allergic reaction, which can very easily end in death. Unfortunately, it just has symptoms that do that. And allergic reactions in general, they're immune-mediated responses. So it's where your body has something that's generally harmless, like a peanut, which is fine. But your body goes, oh no, this peanut is a threat. It's really bad. We need to destroy it. And they release an attack on the peanut, but it's really against themselves, and it results in symptoms that can be really dangerous, which is widespread inflammation, difficulty breathing, hives, dizziness, shortness of breath, low blood pressure, swelling of face and tongue, vomiting, among many other things. Every allergy is a little different, and every person's a little bit different. So, we've done that. We don't have an EpiPen here today, but we do have this video to show you how they work. Oh gosh, that looks weird.
They could be part of a first aid kit. They are in schools anyhow.
Mm-mm. They're user friendly.
Oh, at the top. I know, that's why I was like, this is weird.
Yeah.
I'm gonna stop that because I have it written here and we can't even see the top. I don't know why it's done that.
It's weird.
And it's showing at the bottom as well. I'm not sure what's happening with it. But I'm going to tell you what it's saying. So with an EpiPen,
I think you can close that like picture thing.
yeah, okay. So with an EpiPen is it's like a pen. It's like,
Do you want a pen?
no,
But a thick one.
Yeah.
Yeah.
that's what I'm saying. It's a thick pen. And yeah, like a whiteboard marker. And it has generally an orange side and a blue side. And what the medication inside of it is epinephrine, which is adrenaline. So what it does is it will help to dilate the airways, which, as we identified, is the most important thing to keep someone alive in the short term. So we need that. So an EpiPen is something they'll have on them if they're anaphylactic. And to give an EpiPen, you'll take the blue lid off, and there's a thing to remember. Blue to sky, orange to thigh. A lot of people take the lid off and they're like, that's where the needle comes out. And they put it upside down and they put it in the leg, and the needle, which comes out of the orange side, goes into their thumb. Bad. Blue to thigh, orange to sky.
No, you just said it the other way around.
She would just test it.
It's so easy. It
Good
happens.
job.
Yeah.
Blue to sky,
Yeah.
orange to thigh. Let's all say it together.
Blue
to sky, orange to thigh.
Right.
Good job, Alyssa. You're paying attention. I'm proud of you. So, yes, blue to sky, orange to thigh. It won't go if the blue lid is still on. So you take the blue lid off. It has all the instructions on it, so you don't need to stress. It does have it on it. But you take the blue lid off and you grip it like this. Don't put a thumb anywhere, just in case, you know? Just in case you're not thinking correctly, you do not want that adrenaline shot, okay? It's for them. So you grip it like this, and it's going to go on their leg, about halfway between their hip and their knee, okay? It can go through clothes. Maybe if it's really thick jeans or something, no. But like my leggings that I'm wearing right now, it could go through these, okay? So if I'm sitting down or laying down and I need an EpiPen, you're going to hold it, take the blue lid off, you're going to put it on my leg first, and then you're going to push down and the needle comes straight out. Hold it for 3 seconds and then pull it out. When you pull it out, the orange will extend over the needle, so it's not at risk of hurting anyone. You want to keep that to give to the ambulance so they know what you've had. Anytime you give someone an EpiPen, they need to go in an ambulance. Okay, you can't be like, oh, they're feeling better, yay. Because it's only a short-term fix. Okay, they need to go in an ambulance, they need to get to a hospital or get fixed. And that's another thing. With EpiPens, the same question comes up as with asthma inhalers. Like, well, if Alyssa is anaphylactic and Imogen's anaphylactic, Imogen's having an allergic reaction, an anaphylactic reaction, and Alyssa isn't. And Alyssa has her EpiPen, but Imogen doesn't. Can we use Alyssa's EpiPen on Imogen? The answer for this is no. Because if Alyssa had an anaphylactic reaction, she wouldn't have one. You can't reuse it. It's done. It's one and done. And yeah, so that one is much more strong. Again, up to people. If Alyssa's like, well, I'm a consenting adult, and I say yes, we can't stop her. But we wouldn't say, does anyone have an EpiPen? Give me your EpiPen. If there's a spare EpiPen, if you're at Woolworths and Terry White Chemist is right there, and they might bring you one, I don't know. Sure, but if you would never go into someone's bag and be like, oh, I know you're anaphylactic, let me take your EpiPen from you. No, we can't do that. Because then it puts Alyssa at risk if she were to eat a peanut. Yeah? Okay. I'm sorry that my video didn't work. That makes me very sad. Where's my clicker? Okay. So, we talked about choking, we talked about asthma, and we've talked about anaphylactic reactions. What are some differences in presentation, do you think?
Choking's not always loud. Sometimes it's silent.
Correct. Yeah, sometimes it's silent, but it can also be a lot of coughing. So where asthma and choking can be a lot of coughing, you probably wouldn't find too much coughing with anaphylactic reactions. It's more that they just swell up, you know? They don't get like the mucus build up like you do in asthma. You just get swelling. Anything else?
Dizziness is a bit weird.
The dizziness, yeah, you get dizziness with any of them as well, because that just comes down to reduced airflow. Choking, you'll find people doing this, you know, they're clutching their neck and their eyes are bulging because they're actively choking, they're actively getting it out. Whereas asthma and anaphylactic reactions are a slower build, and it's not an immediate like, oh my god, something's in my throat. It's like my entire airway is inflamed. It's difficult to breathe, so it's very different in those ways.
So with anaphylaxis, you wouldn't be coughing.
Not necessarily that you could be.
Could you?
You could be, but it's not as common. Whereas you said like asthma, a lot of people cough when they have asthma. They have the mucus build up and they cough because you're trying to clear that. Your body's trying to clear that. And with choking, you're coughing. That's what we want them to be doing to try and clear it. That's your body saying, I have something in my airway. I'm trying to clear it out. It's force, trying to move it out. So you could have it with anaphylaxis, but it's not as common as it is in asthma and choking.
Different kind of coughing.
Yeah, and they're all different. That's the thing. Like they're all so widespread, so they could have all kinds of things.
And anaphylaxis is a little bit different that you might see outside, like rash, swollen lips or swollen face, whereas asthma and choking, you probably, I guess you might see red face or blue lips.
Like
but
in the
not-
movies when you see them get an allergic reaction and they start talking funny with the lisp with the big tongue.
Oh yeah.
That's real.
Think like that.
Yeah, that's one of the ones where it's not fake.
Yeah.
That's actually how it happens. Yeah. And why is rapid response so important in these? Because they could die. It's their airway.
That was the first one on our post-it note.
You guys did such a good job breathing. Yay! And if they lose consciousness and stop breathing, what do we do? Doctor's ABC. Yay! Great job. Okay, fracture. Fractures are super common. Who's ever broken a bone? Oh yeah, you did. Yep. Anyone else? Susie has as well?
Yeah, I broke my wrist skateboarding
Oh, there you go.
when I was about 10.
Okay. Let's count them.
Well, I had trouble doing the compressions because I broke that elbow in July. I broke that arm in January. I've broken
This year,
Yes, I've had 2 broken bones this year and pneumonia.
Don't look at me.
I've had a
I've got lots of practice.
spiral fracture of the tibia there. A broken nose twice.
wow, you've got
Lots.
a collection. You should get a punch card.
You get a free coffee.
Yeah.
So Kay just said something. She said spiral fracture, which leads me to my next point. There are so many different types of fractures. We're not going to be looking at specific ones because there's so many. But we are going to look at open and closed. So this shows you a closed fracture, and this shows you an open fracture. The difference is the open fracture has pierced the skin and is sticking out. The reason why that's important for you to know from a first aid perspective is it increases the chances of infection hugely. Like it's wild because suddenly this bone that only lives inside your body has not only been broken in half, but it's also sticking out and getting all the germs and all the animal fur and people coughing and breathing and pathogens and that. You know, risk of infection.
Who knows what's on their
I
hands?
got COVID in my bone. Yeah.
Can I ask a question?
Yeah.
Because it does affect me. You know, I break out the rashes, but I do get swelling inside the mouth. Ice. Does that help reduce the swelling in your mouth for your airways?
I was like, what are we talking about your mouth for fractures? Yes.
Oh,
So,
sorry, go back.
that's okay. So with ice,
Sorry, Sam.
in any swelling and inflammation, ice will help. It'll help to cool it down. Swelling happens and it's accompanied by heat. So ice will help. Yes.
But you don't want to put it in their mouth if they're choking or they're having an anaphylactic reaction. That won't help.
But you could put it, if you wanted to put it on your mouth, on the outside, sure. But yes, putting it in their mouth is bad.
Yes.
Even though you got the lumps growing inside on your
No,
cheeks.
don't do that.
If
and
you're having an allergic reaction, you should seek medical help.
yeah.
Which we do.
Good.
Yeah.
Maybe ask your doctor that in your specific situation. I'm not a qualified nurse yet, and even if I am, I can't diagnose things. So, can't help too much.
I do take throw away some little times.
Okay, well,
Be
great.
careful.
Fractures.
Sorry,
Good, so fractures. Signs and symptoms are pain, redness, loss of mobility. It won't be able to function in the same way that it usually does. It'll be very sensitive, it'll swell. You might hear a grating sound afterwards, with the bone against the bone, and you might hear a breaking sound at the time of the injury.
And people pass out when we hear that sometimes. It's
Yeah.
common.
I would go down.
Alright, so to treat a fracture, we want to immobilize it. If someone breaks their arm, when Kay broke her arm, she did a really good job of holding it herself, of immobilizing it.
When
so
my
that's-
son broke his arm, he didn't tell me.
Mum had that with
Two
Matthew.
different spectrums.
She only realised when he couldn't button his shirt. He was just like, whatever. And she was like, why can't you button your shirt? And that was loss of mobility, normal mobility. You could do other things. But yeah, so sometimes they don't know. But generally, if they're in that much pain, like, I broke my arm, they will do everything they can to immobilise it. Legs are trickier because they'll go down and they might not move, which is cool because they'll just be on the ground and it'll keep it still. But you will need to move them at some point. Arms are easier because you can hold it like this, still hurt, but they will immobilise it themselves, which is great. You want to stop any bleeding that you can, which can be quite painful for them because you want to put pressure on or around it. You don't want to make it any worse, but sometimes you can do pressure above and below the break instead of on it. You'll call the ambulance if they are bleeding a lot. And they will guide you in how to do that. But that is something that you want to be aware of. You don't just be like, yeah, they broke their arm and they're bleeding out, but it's going to be okay. An ambulance on the way. No, you do apply pressure. That pressure will help the blood to clot and stop the bleeding, which won't let them die, hopefully. Then you want to check their circulation, especially if you have applied pressure to prevent bleeding. So to do that, you'll just look at their fingers or their toes or extremities. You want to check for colour, pinkness. Are they turning blue? Are they still warm or are they cold? So if they're turning blue or even white, losing circulation, if they're getting cool, losing circulation. But if they're still pink, the blood's flowing and all that, that's great. We love that. We want it to have circulation. If they have lost circulation, sometimes the break can cut off circulation. So if that's happened and you can't, like rearranging doesn't fix it, definitely call an ambulance because they want their hands, you know. And you can apply ice. And you can splint where needed. Here today, if Kay was to break her third bone of the year, touch wood that you don't, we wouldn't need to splint because we're in a house, we call an ambulance, they'll come quickly, we'll take you to the hospital, all good. But if we are out camping and I fall out of a tree, which is very likely, and I break my leg, and we need to get out so that we can get to an ambulance, you guys are going to need to splint my leg so that I can get out, you know? So with splints, you want them to be firm, fluffy, and straight. So you can use all kinds of things, but you want to really pad them and make them really firm so that it doesn't just move. The whole point is that you want something straight, like a ruler or something, and then you want to put padding around it and like strap it all together so that it keeps it nice and straight and padded. But you definitely want to seek medical attention if you have a fracture because they need to fix it. Otherwise, you're just going to have a broken bone. I know, wild, right, Alyssa? Who would have thought? I didn't do that when I broke my foot. Fine. All right, dislocation. You will know when someone has dislocated something generally because it will look really weird. Their arm will be hanging out or their leg will be hanging out. But what it is, it's a result of high impact, and it means that the bone shifts out of its normal joint, which means that it tears all of the ligaments that usually hold it in there as well. So it can be really, really painful. The number one thing that I want you all to remember with this is, not that, do not reset the dislocation, okay? It's not our job. It's not even your job.
No.
Or your job. Nurses, we don't do that. No, it is not our job at all. Like, it doesn't matter if you're like, oh, my brother does this. No, do not reset the dislocation. You can create really bad nerve damage that can and will affect them for the rest of their life. Leave it dislocated, call an ambulance, whatever you need to do. Treat them and their symptoms, but do not reset it, okay? That's for a doctor to do. So the symptoms are sharp pain where the injury is, and they might have difficulty or just complete immobility to move it. So their arm just might be like that. They just can't move it because their muscles aren't contracting because the joint's out.
Can I just say, with small children, they don't show most of the symptoms except inability to move because they don't actually tear the
they're a bit more
ligaments.
bendy.
They're more bendy.
They
So
are
their
bendy.
only symptom is just not moving.
It's that dead. When it's the elbow, it's that
Yeah.
dead arm. Yeah.
My
It
kids
still
do
needs
a
to
lot.
go in. The doctors just pop it back in.
Yes,
Yeah.
but it's
Still needs the
don't
same
have
treatment.
Again, we're not doing children in this
Yeah.
lesson.
Oh, sorry.
It's okay. I'm just reminding you all that I'm not talking children
Oh,
because it's such a different ball
Children have
game.
totally different
Yes,
bodies.
Susie.
So sorry, just a funny story for your little thing here. We were playing cards one night, had a few beers. I dislocated my husband's finger. I was trying to stop him doing something, and his friend popped it back in. We were in a campground a long way from anywhere, and it was okay, it worked. But I understand with arms and legs and shoulders. Finger, we actually.
I'm gonna go ahead and say that I really need my fingers for my line of work. I would not be letting anyone pop my finger back in. So
Interesting.
there are people all the time. We have people at football games that be like, yeah, my shoulder dislocated. And I've seen
Fingers,
people.
if our fingers aren't any easier then?
Do not relocate anything.
Okay.
This course is telling you we do not relocate.
Even if you're in the middle of the bush.
Susie, there are people that say, oh, I did a pen tracheotomy and they survived. It was great. Great, that's good that that person did it and it worked. I'm teaching you, do not do pen tracheotomies.
Yeah.
Do not relocate joints. It's not your job. It's not our job. None of us relocate joints. Okay? So it's good that your friend did that and that Rob's all good, but I do recommend, do not relocate any of the joints.
Okay.
Any of them.
I won't let him touch anyone again.
Yeah.
No, you can touch them, just only what you're qualified to do. So in a fracture, what you're going to do is you are going to do not
Ah,
reset, okay? You're going to check the circulation, okay? Because it can lose circulation. You might need to rearrange if needed. If you can't recirculate, you need to call an ambulance, okay? You will apply ice, you'll support the limb, and you will seek medical attention ASAP. So that's what you can do. You definitely can touch them. Just don't reset the limb.
I wasn't involved, I was watching.
That's okay. But I'm just saying, people reset things all the time. We see it. We see it at football games. We see it all the time. It happens.
Yeah.
I'm telling you guys, do not reset it. And also,
Back to the Good Samaritan.
I was about to say, you wouldn't be covered in the Good Samaritan Act if you did something out of your
So
out of your
someone
scope.
could sue you.
Yeah, so
This
I
is-
can have a bad story. My mum thought that she had a dislocated collarbone, and so a medical professional of some sort tried to pop it back in place, and it was actually a fractured rib. So then she ended up with another, the more fractured rib from that. So just don't again.
Yeah. Yeah. So with
So it
that,
doesn't matter how big or small it is, I'm thinking a little finger's
a
little.
finger is still important.
It's
Like
still
just because
important.
it's little.
Just don't do it.
Yeah.
Don't relocate anything. Anything that's dislocated. And also it's hard to know if it's dislocated or broken sometimes as well. So you could splint it to another finger until you get somewhere. That's something that you
Break it
can
even
do.
more.
Sorry.
If you're trying to
Relocate.
relocate it,
Yeah.
you're just gonna break it even
Yeah.
more, even if it's just a finger.
Yeah.
So there's so many different things. Like I said, I've definitely seen people relocate things and it's all been fine and it's all flowers and happiness. That's great, but
Not good.
it's not. You shouldn't. Like
So, yeah.
it's definitely not. It's not our place. And what I'm teaching you, do not relocate any joints. Okay. Sprains and strains. It's our last one for this lesson. So, sprains and strains. Sprains occur when ligaments, which is what connects the joints, like we've talked about, they tear with dislocation. They stretch and tear as a result of overextending and stuff like that. So that's where you might sprain something within your joint. So people will be like, yeah, I sprained my ankle, you know? It's because you've rolled on it a little bit, it's torn a bit or completely hurts. Yeah, it hurts, yeah. And then strains are the fibers within a muscle tearing. Okay, so we've all probably had that as well, where you do a weird movement and you get a hamstring tear a little bit and you're like, oh man, it hurts for a few days and it's not fun. They can be really serious. They can also be nothing. They're super common though. They are the most commonly reported serious injury in the Australian workplace. So this is something you guys are very likely to come across in your life. They happen very regularly. So what we can do to prevent them in the first place is to do correct manual handling. I'm not going to going to teach you that, but I'm just going to tell you that. And if you do correct manual handling, you'll prevent it. To manage a sprain, does anyone know? That's what not to do. Does anyone know what to do? There's an acronym. Rise. Well done. Look at you. Good job, guys. Rest, ice, compression, elevation. So we don't want to move it around. If someone sprains or strains something, you want to rest it. You want to apply ice. You want to apply compression. So like an ankle, you can like put a bandage on or something if you need to, and elevate it. Okay. We want to elevate it because we don't want too much blood rushing there because we don't want it to swell. So
Above the heart.
above the heart. So if it's a hand, you don't want it to be like this, you know? You want it to be higher. Or like that. Well done, Alyssa. You learned that at nursing school. I like that a lot.
No, I learned that in first aid first.
Ah, yeah. So above the heart, any way, shape or form, lying down with the leg up, whatever it is.
Helps with the pain too.
It does
It's
because
otherwise
it's throbbing. There's a lot of blood rushing there. It's swelling. The skin's stretching more than it's used to because there's a lot of blood and it's all swollen and inflamed. So rice, it's great. And what if you're not exactly sure what they've done?
Go to the doctor. If you don't know what your injury is, that's what.
Correct? If you're not sure, you're going to treat it as a fracture. So if you're like, not sure what it is, we're going to pretend it's a fracture, we're going to protect it, we're going to put ice. I mean, they're all pretty similar anyway, the treatments of them. But you're going to treat it as a fracture if you're not sure, and you'll seek medical attention, they'll help. But you don't need to be like, oh, it's definitely this. You don't need to know, you know? Sometimes the doctors don't know until they get an x-ray. It's fine. But if you're not sure, treat it as a fracture. And what if you don't have access to a splint or a sling?
You can improvise one.
Yeah,
if you want.
definitely.
So fun. Yes, you can make one if you need to. So like I said, something stiff, some padding, jackets, whatever, a belt to tie it all together, whatever you need. They're really fun activities to do. Yes, it's very fun, creative. But yeah, that's that. And that's all for our second session. Well done, guys. Thank you. We're going to have some dinner now before our third session, so feel free to come into the kitchen.
Wake up, Daddy.
Wake up.
Oh, what are you doing to me? Oh, you're moving away.